Welcome to First Aid Training in the Sioux Falls School District.
Hi, my name is Heidi Laban, and I'm currently the school nurse at Patrick Henry Middle School. I've been with the Sioux Falls School District for 10 years.
My name is Julie Hansen, and I have been with the Sioux Falls School District for more than 30 years. I've mainly worked at elementary schools with early childhood, and I'm currently at Terry Redland Elementary.
Hi, my name is Lacey Duranlo, and I'm currently the nurse at Hawthorne Elementary, and I have been a nurse in the Sioux Falls School District for 7 years.
My name is Laura Parrish, and I am the nurse at Lincoln High School. I have been with the Sioux Falls School District for 5 years.
The purpose of the first aid training is to prepare you to act in an emergency, know what to look for, and how to prevent further harm.
Infection control. Infection control is essential for first aid response to reduce the spread of infectious diseases. Universal precautions is a set of guidelines which assumes that all blood and certain other body fluids are potentially infectious. Always follow these guidelines when providing care to any person. By following the universal precaution guidelines, you will need to make sure to wash hands as you normally would before and after meals, toileting, and food handling. Wear gloves whenever you are in contact with blood or any other bodily fluids. Wear protective eyewear when there may be a chance of body fluids coming into contact with your eyes. Wipe up any blood or body fluid spills as soon as possible. Send all soiled clothing home with the student in a double-bagged plastic bag. Do not eat or touch your mouth or eyes while you are giving first aid.
Asthma. Early signs and symptoms of an asthma attack include difficulty breathing, wheezing, tightness of the chest, difficulty talking, stress, anxiety, or a dry cough. If you notice an individual with any of these symptoms, sit him or her down and allow them to lean forward to open the airway. If the individual is a known asthmatic, refer to the care plan and ask if he or she has medication. If so, have the individual use it. Continue to offer encouragement. If there is no medication available, have the individual sit quietly, breathe slowly and deeply, in through the nose and out through the mouth. If symptoms persist, follow the plan of care. If there is no plan of care and/or the condition worsens, call for help and send a responsible individual to get the AED.
Human and animal bites are common sources of injury to young children. Determine the seriousness and the nature of the injury. If the injury seems minor and skin is not broken, simply wash the area with soap and rinse with water. If the skin is broken, large, gaping, or bleeding is not controlled, seek medical attention right away. These images show a comparison between a human bite, snake bite, cat bite, and dog bite. Many insects bite or sting. Symptoms of an insect bite or sting are caused from the venom that is injected into the skin. Venom can cause both irritation such as pain, itching, and swelling, or a severe allergic reaction such as difficulty breathing, swelling of the face, lips, tongue, mouth, airway, and tightness in the chest. Individuals with a history of an allergy to stings should be known to all necessary staff. A care plan should be followed. This image shows a comparison between a bee sting, bedbug bites, and a mosquito bite.
Allergic reaction. Allergic reactions can appear as hives all over the body, paleness, seizures, confusion, weakness, loss of consciousness, flushed face, blueness around the mouth, drooling, difficulty swallowing, or dizziness. Breathing may slow down during an allergic reaction. If you see someone who is having an allergic reaction or displaying these symptoms, you need to call for help right away and send someone for the AED. For an individual with a known allergy, guide them to use their auto-injector following the recommended guidance. Give constant reassurance until help arrives. While waiting for help, position them in a comfortable position, leaning slightly forward, and monitor their condition until help arrives.
A burn is an injury to the skin caused by heat, radiation, chemical, or electricity. Always make sure the situation is safe before helping a student. Heat burns most often occur from scalding liquids, steam, fire, flame, or hot objects. The most common type of radiation burn is sunburn. Chemical burns are caused by corrosive or caustic substances. Electrical burns are caused by contact with electricity. The type of medical care needed for a burn will depend on the size, location, and depth of the burn. Medical help is needed if the burn is large, deep on the face, eye, or if the individual is having difficulty breathing or if they are unconscious. This image shows pictures of the different degrees of burns. The depth of a burn is defined in degrees. A first-degree burn is a minor burn on the top layer of the skin. The skin will be pink but will not blister. This degree of burn can be rinsed under cool water and covered with a sterile bandage. A second-degree burn injures the top layer of the skin and some of the tissue below the skin. The skin will be dark or bright red with blisters, pain, and swelling. A third-degree burn is the most serious. It involves deep tissue under the skin and can damage muscle and nerves. Rashes have many causes, including infection, viruses, bacteria, medication, bites, allergic reactions, and dry skin. Rashes can appear as hives, red spots, scaly skin, small blisters, or bumps and pimples. Many are only a minor annoyance, but some can be serious. If rashes have open sores, are weeping, and/or accompanied by a fever, medical attention should be sought. Here is a highlight of a few of the most common school-age rashes. Strep throat and scarlet fever are different forms of a bacterial disease that is contagious. When the bacteria infect the throat, the illness is called strep throat. Strep throat symptoms include a fever, an inflamed, painful throat with swelling of the tonsils. When the bacteria produce a toxin which results in a distinctive skin rash, the illness is called scarlet fever. The rash is a red sandpaper-like rash that appears primarily on the trunk, worse on the underarms, groin, inner thighs, and behind the knees. Hives are red, itchy, raised welts on the skin that appear in varying shapes and sizes. Hives are the result of the body's reaction to certain allergens or for unknown reasons. Fifth's disease is a mild viral illness that is contagious and causes a bright red rash on the child's cheeks as well as a possible lace-like rash on the trunk. Impetigo is a common and highly contagious bacterial skin infection, usually appearing as red sores around the face. Cuts and scratches are common in school-aged children. Medical care of the wound depends on the size, depth, and if the bleeding can be controlled. Generally, soap, water, and a clean gauze is all that is needed for first aid of the wound. Medical attention should be sought for bleeding that cannot be controlled or for deep, gaping, and large wounds.
Bleeding. Bleeding occurs when the skin is cut and a blood vessel is broken. Some blood vessels bleed more than others. The seriousness of the injury is determined by the type of blood vessel and the depth of the cut. To stop or control bleeding, you will need to protect yourself by wearing gloves if possible. Apply pressure using a sterile dressing or clean, dry cloth and press on the wound. This technique is known as direct pressure. Elevate the bleeding body part gently. If a wound is gaping, it may require stitches. Contact parent and urge medical care right away. To apply a dressing, a gauze pad may be used for a deeper, larger cut. Secure the pad with tape. For smaller cuts, an appropriate size Band-Aid can be used. Signs of excessive bleeding include dizziness, weakness, confusion, and fainting. An injury that is deep in the chest, abdomen, or brain can cause internal bleeding. This usually is very painful, and the person will appear very ill. If you suspect internal bleeding, contact emergency medical services immediately. Nosebleeds. A nosebleed simply means that blood is coming out of the inside of the nose. Bleeding usually occurs only from one nostril. Blood can also drip into the back of the throat or down into the stomach, causing a person to spit up or even vomit blood. To stop a nosebleed, you will want to have the individual sit with their head slightly tilted forward. Encourage the individual to mouth breathe and not to blow their nose. If blood is flowing freely from the nose, provide constant, uninterrupted pressure by pinching the nostrils firmly together for 5 minutes. You can also apply ice to the nose while pinching it to stop the bleeding. After 5 minutes of pinching, assess if the bleeding has stopped. If it has not, apply constant pressure for an additional 10 minutes with ice applied to the nose. If blood continues to flow freely after 15 minutes, contact emergency medical services or get medical help and contact the guardian.
If the individual presents with pain and swelling but continues to move the injured part, rest, ice, elevate until the person recovers. If an individual has a deformity, open fracture, or is unwilling to move the injured part, keep the part still, control bleeding, ice, Contact a guardian to seek medical attention. If the neck or spinal injury is suspected, do not move the individual, but maintain head and neck in the position the child has fallen. Notify guardian and call for medical help. Here are some images of what fractures, sprains, and dislocations may look like. If an individual presents with a head injury other than a bump on the head, always suspect a neck injury as well. Do not move or twist the back and neck. Have the individual rest laying flat. If the individual is vomiting, turn the individual to their side, keeping the neck and head aligned. Call for help. If the individual is not vomiting, monitor closely for any other symptoms. Notify building medical staff and guardian. Even if the student was only briefly confused or seems fully recovered after a head injury, notify parent or guardian so they can watch for delayed symptoms.
Vomiting is the forcible, voluntary, or involuntary emptying of stomach contents through the mouth. This can have many causes, including illness, such as GI infections or bulimia, anxiety, pregnancy, injury or head injury, heat exhaustion, overexertion, allergic reaction, high fever, and food poisoning. If food poisoning is suspected and many staff or students, make sure to contact poison control. When an individual is vomiting, you will want to wear gloves and protect yourself from that person's bodily fluids. Next, attempt to take the person's temperature. A temperature of over 100 degrees Fahrenheit is considered a fever. Have the individual lie down on their side in a private room where they can rest and have a bucket or trash can nearby. Do not give the individual food or medication, only sips of water or ice chips as tolerated. If the individual has repeated vomiting, fever, vomit is green or bloody, or if recently had a head injury, you will need to call the guardian and urge medical care.
If you should see someone having a seizure, first it is important to not panic and to remain calm. If the seizure presents as an episode where the individual looks confused, off balance, or disoriented, you will follow the person around, making sure that they are not causing any harm to oneself or others. If it is a generalized tonic-clonic seizure, you need to put the person down on the ground or floor, turn them on their side to prevent choking if they would vomit. You should start timing the seizure. If they are jerking around, do not restrain them. Keep them in a safe area so they do not cause more harm. Do not put anything in their mouth. Following a seizure, there is oftentimes a period of sleepiness, confusion, disorientation, and tiredness. A student with a history of seizure should be known to staff and have a care plan in place. If it is a stranger you have never seen before, if there are breathing difficulties, if the seizure lasts longer than 5 minutes, or if the individual is having multiple seizures back to back, you should call for medical assistance. Unconsciousness. To find out whether an individual is unconscious or not, ask them if they are okay and gently shake their shoulders.
You okay?
If they do not respond, you will need to call for help. Lay them on their back and check their breathing by placing one hand on their forehead and 2 fingers on your other hand on the tip of their chin. Gently tip the head back and raise their chin to free their airway. Place your ear next to their mouth for around 10 seconds and try to hear if they are breathing. Watch their chest to look for any movement. If they are breathing, place them in the recovery position. Put them in the recovery position by kneeling next to the person. Place the arm closest to you straight out from the body. Position the other forearm against their cheek. Then take hold of their knee furthest from you and pull it towards you until the knee is on the floor positioned at a right angle. Make sure that the airway remains open by tilting the head back and lifting the chin. Monitor the condition until emergency help arrives. If they are not breathing, begin CPR. The picture on the left is the universal sign of choking. In the event you come across an individual who may be choking, ask the individual, "Are you choking or can you speak?" If the individual nods or cannot speak, that individual needs medical help. As you see in the picture on the right, stand or kneel behind the individual with arms encircling the individual. Make a fist and place thumb side of fist against middle of abdomen just above the belly button and below the ribs. Grasp the fist with your other hand and give quick inward and upward abdominal thrusts. Repeat until object is coughed up and person is able to breathe, or until the individual becomes unconscious. If the individual becomes unconscious, call for help and start CPR. Always know where the AEDs are located and who the CPR trained staff are in your building. Anyone can use the AED. In the event that an individual needs CPR, make sure a responsible adult stays at the scene and provides help until medical help arrives. Call for help and send someone to obtain the AED. Ensure that an individual is face up on a firm and flat surface. Begin CPR and use the AED. Continue to administer CPR until the individual shows signs of life or medical responders arrive at the scene. If you would like to be trained in CPR, certification is offered through the school district a couple times throughout the school year.
In conclusion, when following emergency procedures for an accident or an illness, please remember to assess the situation, ensure the environment is safe to approach, follow the recommended procedures for the situation, and notify the medical staff in your building for appropriate documentation and reporting. Thank you for participating in this first aid training.